Hey everybody, it is your favorite stylist here. It is Melanie Day with You've Got Curls and Hair Loss Center. And this is really exciting because I always love sharing, really cool stuff and obviously evidence-based things. And just wanted to kind of share this. So when I first met our next guest, some of the things that I really appreciated about her was her kindness, genuine willingness to help patients with hair loss, and determination to help the next generation of dermatologists learn about skin of color. And how many of you are struggling with hair loss, or maybe you have friends and family that are, suffering with hair loss? Or maybe you've even thought about this. What are the best ways to build trust and a partnership with your doctor? Or what are the current hair loss solutions and new medications that are on the market today? It's exciting because we're going to talk about all of that. So make sure that you're staying tuned. But I've invited an expert, not just any expert, to answer those questions, but a board-certified dermatologist with over 27 years dedicated to building up the dermatology research unit at Wake Forest Baptist in Greensboro, North Carolina, and being the first Black female to chair at the hospital. Dr. Amy McMichael, how are you doing today?
I am fabulous. Thank you, Melanie. Thank you so much for having me. It's really a pleasure to be here.
Yes, I'm so excited. So, like I said, the last couple years when I first initially reached out to you, I just loved how you just always shared information with me. And I think initially I had a client that was struggling with CCCA, which is the form of scarring alopecia, and she really wasn't able to find the solution. So somehow the internet brought us together, and I'm so happy. I'm so happy that it did. So I know everyone likes stories. I love stories. What was your why for getting into dermatology? Like, why are you a dermatologist?
So dermatology, that story is easy. Hair loss and alopecia, that's a little bit less dramatic. But, when I was in medical school, I really only liked certain parts of every rotation. I knew that when I came in, I wanted to deal with, people of color. I grew up in a Black neighborhood, even though I went to a school that was mostly Caucasian. And I really wanted to help the people in my sort of sphere as I grew up. And I wanted to do a little bit of everything. I wanted to do a little bit of surgery. I wanted to see kids. I wanted to see adults. I knew I liked medicine that was not necessarily in the hospital. So I like ambulatory medicine. And so when I sat down and really put all that together, it added up to dermatology. And, it wasn't so popular back then. It was still competitive, but, there was no Botox, there was no fillers, there were very few lasers, they were very medical, and most people didn't do them. So I never really went into it with that. And hair loss was a very small part of dermatology at the time that I went in there. And really no one was doing hair loss in African-American patients. So, those were not the things that brought me in, but those were the things that kept me excited and got me excited. And so when I came to Wake Forest to interview, I was finishing my residency at University of Michigan, and the chair, former and founding chair, Dr. Joe Urizzo, asked me, well, what's your niche going to be? He was a big believer that if you have a niche in medicine and academic medicine, that it's going to take you really far because you can do research, you can see clinical patients, etc. And, I really hadn't thought about it much, but, in that split second that he asked me, I thought back to the patients that I thought I could help the most. And I remembered being in hair loss clinic in University of Michigan and, very learned professors trying to help these patients with hair loss. And when the women of color would come in, they would give their best, recommendations. And then these women would look at me, to get the real, the skinny on what they said. And so I thought, I think I see a niche there. And I quickly said, hair. And he said, great, hair and nails. I said, no, not nails, just hair. So I'm a general dermatologist. I even do a little bit of cosmetics, but my research And, one of my big passions is hair loss and treatments for hair loss and research in hair loss.
Yeah, I love that because this is something that I hear on the regular, especially being behind the chair. I actually just had a conversation with a client the other day and having conversations with dermatologists, and she's kind of frustrated because she's been to quite a few and still not, understanding what's going on or what to do. So, with that in mind, how, what are some ways that a patient can build that bridge with their dermatologist and for them to get, everything that they need?
Yeah. Well, the first thing is to make sure you're seeing a board certified dermatologist, because there are people out there who call themselves dermatologists, but they're really not. They may have come from another specialty. They may, be a surgeon, and they may do hair transplants. You just don't know unless you specifically ask and you say, "Are you a board certified dermatologist?" So that's the first thing. And then the second thing is, when you're calling for your appointment, you can ask, is this person somebody who sees hair loss patients? Because there are some people for whom this is not a passion.
Right.
And, they have passions for other things, and they're very good at other things. And so you don't want to go to somebody who really doesn't feel like this is something that they can address, and it can give you really, good recommendations and understand what you're going through. So that's the first thing, pick the right person. People who have hair loss and alopecia on their websites, that's a good place to start. If they've written papers or done research in the area, that's even better. So, you have to do your homework a little bit when you have a specific disorder that you want somebody to address. You can't just go to anybody, because they may be a fabulous dermatologist, and they may, be great if you have a skin cancer or eczema or psoriasis. But when it comes to hair loss, it is a little bit more specialized. So make sure that that person is interested and involved and knows the up-to-date information so that they can give it to you.
Right. So I don't, like you said, board certified. So isn't everybody board certified?
No, actually not. So what board certified means is that you have actually done a 4 years, at least 4 years of a residency, internship, which could have been in internal medicine, pediatric surgery, and then 3 years of dermatology, which makes you board eligible. Okay, so once you finish your residency, you're eligible to take the boards. And then in order to be certified, you actually must take the board exam. And so if you're not board certified, it could mean that you never took the exam. You did the training, but you never took the exam, or you took the exam and you failed it, you never took it again, or you're not a dermatologist and you're board certified in something else like family medicine or surgery. A lot of people want to do dermatology because it's wonderful and we have a great patient population. We have wonderful patients. We have wonderful treatments. And so they say board certified, but they're board certified in another specialty. So you want a board certified dermatologist. You don't want somebody who's a doctor in another field who's hopped over and is doing something new now.
Yeah. Okay. I had no idea. I had no idea. See, this is why we have these conversations.
That's right.
This is why we have to have a talk. We got to have a conversation.
Yes.
Because, like I said, the internet has been great. It obviously brought us together, but at the same time, there's a lot of misinformation that's being stirred around, and everybody is an expert in their own right. But what's the evidence behind it? And that's why I wanted to present this. So seeing a board certified dermatologist, picking the right person, looking at their website, not being afraid to actually asking them, like, hey, like, are you specialized in this? How many patients have you seen? And actually, one of my clients, that she did ask the doctor that question, how many patients have you seen with hair loss? Not a lot. Honestly, that's good. But it didn't make her feel very confident. So that's when she went and started looking for someone else. So that's really good to know. Now, what if you live in an area where, because like you said, dermatologists who specialize in hair loss may not really find a lot of them. And that's something that a lot of people are running into. What do you recommend?
Yeah, so there's a couple of things. One, if you have a good dermatologist that you trust for your other skincare needs, they often will know who specializes in hair loss. And so they'll tell you, they'll say, okay, go to these 2 people or these 3 people in your area. People in big cities are lucky because there's a lot of dermatologists generally in big cities.
Yeah.
And if you don't mind traveling, they may tell you about somebody who lives somewhere else. So I see patients from Virginia, South Carolina, from Tennessee. I mean, I even see patients from Philadelphia sometimes, Washington, D.C. It just depends on if they can travel.
Wow.
So, if you can travel, that's great. If you can't, one of the things that you can do is to try to see who has virtual appointments. There's some hair loss experts who have virtual appointments. I do not.
Okay.
I did for a very short time during the worst of COVID, but we've flipped over, and only a couple of providers here in our department have virtual appointments, and they're not hair loss experts. But you can find that, and that might be, something that will tide you over. Obviously, if you need an in-person treatment or a biopsy, you're not going to be able to get those things. But you can, travel to see a dermatologist who has a special interest in hair loss, and they can guide your dermatologist as to what to do. And so I do that all the time. I do treatment plans. I see people sometimes are overseas.
Okay.
So they come once or twice, and they get, I give them a treatment plan, and their dermatologist is smart, and they went, they did dermatology residency. They can figure it out.
Yeah.
So they just need a direction. So sometimes that works as well. So, we will work with you, whatever you need. Most people who are interested in hair just want their patients to be better.
Yeah.
When we talk about, hair loss, and let me just clarify one term about hair loss is equal to alopecia. People oftentimes, we have a whole discussion about their particular form of hair loss. And, there are a number of forms of hair loss. They're not all the same.
Mm-hmm.
And then at the end of the discussion, my resident and I have, talked about approach. We're going to talk about this medication, and everybody's all set. And then at the end of that, they say, well, do I really have alopecia? And I'm like, oh my goodness. Okay, let's start from the beginning. The word alopecia means hair loss. Okay. Alopecia areata is a specific form of hair loss. And we can talk about that specific form of hair loss later. But
Yes.
I just don't want people to use alopecia in talking about that form of hair loss where there's patchy disease or potentially full hair loss, full baldness. That's a specific form of hair loss. So alopecia equals hair loss. And so our medical term for hair loss is alopecia.
I'm happy that you said that. So since you brought up the topic of alopecia areata, let's talk about that. How common is it? Is it more common in women? Is it more common in children? Is it genetic?
Yeah, and a lot of the things that you mentioned are true. So what we know about alopecia areata is that it's an autoimmune disease that is genetically predisposed. So what does that mean? Well, people are familiar with lupus, they're familiar with thyroid disease, maybe MS, those sorts of things, rheumatoid arthritis. Those are all autoimmune diseases. So they're not diseases that you can take a supplement and it'll go away, or you can eat more fish, or you can eat less fish, or, exercise it away, lose weight, and it gets better. None of those things work for autoimmune diseases. That the autoimmune disease means that your immunologic system is genetically programmed to attack a specific organ. In the case of thyroid, it could be the thyroid. In the case of rheumatoid arthritis, it's the joints. In the case of alopecia areata, it's the hair follicle. And so we can't turn that off. You have to pick new parents, basically, because you've got your genetic codes from your parents, and they got them from their parents, etc. So when the genetics are there, you're predisposed, then you can get this disease. Now, we still don't understand what turns autoimmune diseases on and off. Okay, no one does, and it's not. I guarantee you, it's not supplements. That would be a lot easier, but it's not supplements. And so once you have the first initial onset of alopecia areata, you may have just one episode in your entire life. But unfortunately, many people go on to have many episodes or prolonged episodes where the white blood cells attack the hair follicles and basically put them to sleep. And
Hmm.
so that's a good thing in a way because it doesn't destroy the hair follicle, because we know there are forms of hair loss where that does happen.
Right.
But it doesn't destroy the hair follicle. So if you can get the inflammation down, you can't turn off the autoimmune disease process completely, but if you can get the inflammation down, then you can regrow hair. And we do it in a lot of different ways depending on how people present. So sometimes people present with just a small little round circle of hair loss, is smooth, like a baby's bottom, no
We've got
hair.
pictures. We've got pictures.
When we look up close with our dermatoscope, which is our magnifier with a little light on it, we can see changes. Sometimes we see yellow dots. Sometimes we see black dots, which are hairs that are broken. Sometimes we see a little inflammation. But what we can see is that the hair follicles are still there. And so if we are clear that this is alopecia areata and it's a small little circle, we may give you some cream and that might do the job. We may give you some cream and inject a little bit of steroid medicine into the area.
Hmm.
Same steroid medicine that you get when you go to the emergency room after you've had like an allergic reaction, but instead of putting it in your hip, we put it in the skin, and it just stays in that compartment and doesn't cause any side effects or complications, other than it stings a little bit when we do the injections.
Right.
Sometimes we have to do a few injections, usually it's monthly or every 6 weeks, until the hair starts to respond. And then if we're not getting anywhere, we used to have only a few other things that we could try. Steroids by mouth for a short course. And here's a great picture of this disease. Steroids by mouth. We would use sometimes a drug called methotrexate, which is actually a chemotherapy agent, but we use it in tiny, tiny doses, the same as people who have rheumatoid arthritis or psoriasis might use it. And it can actually take down the inflammation and allow hair to regrow. And what you're showing here is a photo from one of the studies looking at alopecia areata patients. So those are the patients that have this specific autoimmune disease who were in a trial for a new drug that it was just recently approved. It's called baricitinib, and it is going to be an amazing thing for our patients with alopecia areata. Now, it doesn't treat other forms of hair loss. It just treats alopecia areata. Interestingly, though, it does treat other diseases. So it treats psoriasis in some cases, and in some cases it treats eczema. It's not approved for those uses in this country, however. It just is approved for alopecia areata. And it's only approved for adults, so 18 and above at this point, although some of the studies did have children in them. We don't have that approval yet. And what this drug does is it goes in and it's a very specific blocker of something called the Janus kinase inhibitors, or the JAK STAT pathway. So it's an inhibitor of that pathway. That pathway was identified within the last 15 years by a number of investigators, but primarily by Angela Cristiano, who's an investigator out of Columbia up in New York. And she had a mouse model and then was sort of on the pathway to finding that this, could work for alopecia areata, and ultimately did prove that. So we're very, very lucky that, the JAK-STAT pathway was found. She didn't identify the JAK-STAT pathway. That was some other folks. But she was able to show that blocking that pathway in a very specific way could allow hair regrowth. Now, no drug is without side effects. It's a pill. And sometimes you have to start low and go a little higher. Sometimes you can have side effects. And so, we do have to have people in the office understanding what we're doing so that they know what to expect and know how it needs to be managed. But it is really one of the biggest breakthroughs in my lifetime as a dermatologist. And I'm just so excited for my alopecia areata patients to be able to start this medication.
Yeah. So how, because especially with new medications, they're expensive and sometimes they're hard to get to. So how easy is it?
Yeah, good question. So we've probably got about 5 patients on the drug so far, because it's only been out for about a month. And we are working with, luckily the company is actually doing a little bit of a bridge program to help people get on this. Now, of course, it's going to depend on your insurance, and it's going to depend on, what level of insurance you have. People say, well, I have insurance, but, they don't really understand that their coverage for medications is very minimal, that
Right.
sort of thing. So it really does depend on that. And so what you have to work with is your doctor's office, your dermatologist's office, to write all the necessary, information about it so that you can get what's called prior authorization. This is one of those medicines you can't just write it and go pick it up at the pharmacy. It usually comes from a specialty pharmacy. You have to have prior authorization to get it. And we're lucky here at Wake Forest that we have internal departmental pharmacists. So as a result, our patients oftentimes get the medicines we want because they know how to get the medicines. They know how to help us get the medicines, and they're very knowledgeable. But not everybody has that in their office. So it takes a while to sort of learn what the insurance companies need in order to approve the medication. But we're learning, and many doctors are going to be prescribing this medication in the years to come.
Okay. Well, this is exciting. So I know this is probably like a Cliff Note version.
It is. You're right.
Yeah, a Cliff Note version of this. I think we might have had a comment earlier that you probably saw that scrolled through, as far as, really appreciating, the explanation of alopecia areata, and now everything kind of makes sense. So that this is why we're here. So I'm happy that that explanation was put in there. So the new medication, we said it's used off label for other things: rheumatoid arthritis, psoriasis, now alopecia areata. What are some other things, like, say for instance, you have a patient that has maybe CCCA or scarring alopecia, androgenetic alopecia at the same time.
Yeah.
Have a doctor that's wanting to compound to do a topical, or wanting to like an oral medication. How does that work?
Yeah, that's a good question. So CCCA, everybody might not be familiar with that. A lot of my patients don't know what that is. It's central centrifugal cicatricial alopecia. That's the long name, but we say CCA for short because it's easier. This is a form of hair loss that is different from alopecia areata in that the white blood cells attack the hair follicle and they try to kill it. And they do a pretty good job of it. It starts usually as a small little oval area on the crown of the scalp, and it widens. So that's where we get the centrifugal. And it's central because it's on the central scalp, and it's cicatricial. Cicatricial means scarring. So this patch just gets bigger and bigger and bigger. And a lot of times people don't know what it is, and it kind of comes and goes a little bit. So they think it's okay. And then all of a sudden it doesn't come back anymore. And that's a really, really common thing that we see in women of African descent. So what we need to do is take down inflammation again. Same premise, right? But the mechanism is not the same. As far as we know, it doesn't work through the JAK-STAT pathway. So baricitinib is not a good drug for that. Okay. So what would you need for that? Well, you need something that could take down inflammation. Remember, we started with the other one, topical medication. So topical steroids might be a really good one. Not the kind you can get over the counter, things that are prescription, because they have to be pretty strong to get through that thick skin of the scalp. And we don't worry about the scalp thinning because typically it doesn't with topicals. And we might do injections again, because that's another good way to get inflammation down. Sometimes we'll use an antibiotic, typically one that's not used for other things, so that we don't worry about, making them, not reactive to that antibiotic if they get sick. So we take, maybe doxycycline or something in the tetracycline family and have them take that, but for a short period of time, maybe 3 to 6 months, to take down inflammation. And we can also do, once we get the inflammation down, we can also do things that kind of prolong the hair to staying on your head. And, everybody and their mother that I tell to use minoxidil or Rogaine says to me, oh, I don't want to use that because then I'll have to use it for the rest of my life. Well, listen, the problem is that the problem is that the condition lasts for the rest of your life. So if, unfortunately, we don't have a drug that just turns it off and cures it. And so as a result, you may need to use these medications for a prolonged period of time, of course, under the care of appropriate dermatologists. So when your doctor says, okay, let's try these things, you have to be open and willing to talk about them, the potential side effects, which are very few in these drugs that I'm talking about now, and try them for a long period of time, because what we're trying to do is not turn back the hands of time and get the hair you had when you were 12, but to stop the process. Okay. When you got a scarring process, those hair follicles, some of them are dead. We can't bring them back, but we can stop it from getting worse. So the key is to get in early. Don't wait till this thing is over the
Did we lose
entire top
sound?
of your scalp. What's that?
Did we lose sound?
Uh-oh, I can hear.
I can't hear anything. I'm not sure what happened.
Okay. I don't know.
I can hear. Okay. I can't hear.
Uh-oh.
Just,
Okay.
I don't know what
Hopefully our
happened.
tech person is working on it.
So I think what you were saying was, we'll run with it. I think what you were saying was that it stops the inflammation. You know, the medication helps to stop the inflammation, and you want to continue with it because it's something that's going to be, you know, lifelong. But you, thank you. You can still hear. You're not going to have the hair that you had when you were 12 years old.
Yes.
But to work with your doctor and to be open-minded. I like that.
Yes, absolutely. And just remember that there are organizations out there that have good information. Don't use the internet as your source, but there is a wonderful organization. It's a great website that has a lot of different scarring alopecia. So not just CCCA, but also like Implano, Pilaris, and others. And it gives a nice medical explanation of what you have, treatments, and ongoing research.
Yes. And now correct me if I'm wrong, but this is probably one of the few organizations that actually has money funded for research for scarring alopecia. So this is probably where I'm assuming maybe like where this new medication research came from, right? As far, maybe that's not scarring alopecia.
Not yet, but for the alopecia areata, it came from pharmaceutical companies. So companies. But for the scarring forms of hair loss, we don't have companies yet. We're looking for a company to help us develop a medication. But the Skin of Color Society, I'm writing this for Melanie, Skin of Color Society.
Okay.
Is one of the biggest.
Yes, that's another one, Skin of Color Society. And I've actually referred quite a bit of clients or patients to this website. So this is international, right? Skin of Color Society?
Yes, it is. But there's probably the biggest is in the U.S. So the biggest group is in the U.S.
The biggest is in the U.S. Okay.
Yep. Okay. And you can get referrals to doctors who care for hair at that site.
Okay, that's good. So this is for everyone that's watching and listening today, these are amazing resources to go to. Please visit Skin of Color Society to find board certified dermatologists, and they are very proficient with skin of color of all ethnicities of skin of color. And then also make sure check out scarringalopecia.org. That is a wonderful resource for individuals who are experiencing the different forms of scarring alopecia. The research, you can ask questions. It's a lot of information that's on there. So this has been exciting. Dr. McMichael, thank you so much.